You missed the big picture. The big picture, the healthcare system do harm to their patients. And that's why Jackie O and many others are no longer with us. Exactly. 2 days ago, I did a video on this book, How We Do Harm by Dr. Brawley. And he gives 5 major points that how the healthcare system is taking my family, your family, the rich, the poor, everybody totally out. By the overuse of screening tests, Dr. Brawley argues that many patients are subjected to unnecessary and potentially harmful screening tests, such as mammograms and prostate-specific antigen (PSA) tests, which can lead to false positives, unnecessary treatments, and undue anxiety. He cites evidence that many cancers detected through screening would never have caused problems or shortened the life expectancy if left untreated. Additionally, screening tests can have significant financial costs and may lead to further invasive procedures that are unnecessary. Overtreatment, Dr. Brawley states in his book, highlights the problems of overtreatment where patients receive unnecessary and sometimes harmful medical procedures such as surgeries, chemotherapy, and radiation therapy. They can occur due to financial incentives, defensive medicines, or the pressure to do something in the face of uncertainty. Dr. Brawley argues that overtreatment can lead to unnecessary harm and suffering for patients, as well as increased healthcare costs. Health disparities. Dr. Brawley also explores the issue of health disparities, where certain groups of patients, such as racial and ethnic minorities, the poor, and the uninsured, receive lower quality care and have worse health outcomes than others. He argues that health disparities are a result of systemic issues such as discrimination, unequal access to health care, and implicit bias among healthcare providers. Dr. Brawley emphasizes the importance of addressing health disparities to improve overall health outcomes and reduce healthcare costs. Medical errors, Dr. Brawley cites, discusses the problems of medical errors, which can range from medication errors or surgical mistakes to misdiagnosis. These errors can have serious consequences for patients, including disabilities and death. And Jackie O is no longer with us, and many others. Dr. Brawley argues that medical errors are preventable and result from systemic issues such as inadequate training, poor communication among healthcare providers, and a culture of blame and punishment rather than learning and improvement. Lack of patient-centered care. Finally, Dr. Brawley argues that the U.S. healthcare system often fails to provide patient-centered care, where patients' preference, values, and goals are taken into account in the medical care system. Instead, patients are often treated as passive recipients of medical interventions rather than active partners in their own care. Dr. Brawley emphasizes the importance of shared decision-making and patient empowerment in improving healthcare outcomes and reducing patient harm. Rest in peace, Jackie O, and to the many people that left under the healthcare system. I couldn't believe, well, another life has gone before. But not only that, the healthcare system also cost the lives of Michael Jackson, cost the lives of Kanye West's mother, Dante West, cost the life of Joan Rivers, cost the life of Chris Connell. She was a musician and singer. and cost the life of actor Bill Paxton. There were many lives that the healthcare system cost, and something could have been done. These deaths could have been prevented. And my God, we won't go into COVID now, will we? But that's what I wanted you all to know. That's why I'm in this space. Some of us made it out, not totally, because we were all at risk. And yes, I want to see everybody out there get their money back. Yes, I do. And like I said, I'm proud of anybody who has that success. But what frightens me, you can have the success and the money, but that doesn't mean that your money is going to spare your life. The rich is overtreated, and the poor is not treated or undertreated. And so, what I have to say to each and every content creator, before you do another story on Jackie O or anybody that slip out of this life, think about the big picture. And that big picture is our healthcare system. That's the big picture. I looked at so many streams today on this young lady, and it all got personal. It all went to this young man's, how much money is he worth? And this young man has lost the love of his life, the mother of his children. And it's unbelievable. Unbelievable. But it will not stop. It won't stop until we start policing our healthcare system. And how do we go about policing our healthcare system?
By holding them accountable.
What did you say, Kenny?
By holding them accountable.
Could you chime in on this for me?
Yes, by holding the doctors accountable, by asking questions. Many times when we go in, let's say for eyes, when we don't ask the correct questions like our eye pressure. It's supposed to be not a unilateral decision. Unilateral meaning one way. It's two ways. A doctor and a patient come together and compromise, not with medication for a solution, but integration of a proper diet and some medication. But here's the thing about medication though. If a person believes that they're doing better, then the doctor is not supposed to keep adding medication. You're supposed to take away medication. By adding medication, you're subtracting a person's chances of survival and getting off medication, but being hooked. Because sometimes the medication not only treats the symptoms, then there's another problem arise known as depression, which is more psychological. And with these like morphines or painkillers, people treat depression not by talking to people, but they use the medications to numb the pain, which is dangerous.
Did we not lose many icons?
Prince was one of them. Another one we lost, David Carter, who used to play Kung Fu: The Legend Continue and Kill Bill. We also lost Robert Williams.
We lost Whitney.
At the age, she didn't make 50. She was 49 when she passed.
And all of these people had money. Did they get better treatment?
No.
Did they get a better intervention?
No.
And like I said, tonight I truly in my heart want to apologize to all the younger people, because I really thought that, when you're older, you're just out. But that's not true. That's not true at all.
No, the young was going out like Fast and Furious.
And I'm going to say it again. I'm here in this space for a reason. And that reason is I live this already. I'm a part of this book. And I promised myself, making it out alive this time, I would come to this community and let them know, yes, I want to see your success. I want to see you happy, travel, do all the things that you want. But more than anything, my heart rides with health. And I want you out there advocating for your life, because it's not just your life. It's going to affect your family, your children, your friends, to the community, to all the content creators, influencers, whatever name you go up under. Please get this book. Read this book. And if you're going to report something, report the facts. Report the facts. Because that's not what has happened. Nobody, after COVID, after all those losses, nobody got the opportunity to say, well, I'll go over here and I'll grieve grandma. Well, maybe I'll grieve daddy. That's not the way it works. It doesn't work that way. No grief has not been addressed. And our nation is sick because we have a broken healthcare system. And that healthcare system has done monumental harm. So to all you YouTubers, to all the young people, elders, everybody out there across the world, please strap up.
And skill up.
Skill up. And fight for your life. Because all these doctors are quitting. And they will be replaced by people that don't have the skill or expertise to do the complexity of the surgeries. Think about it. Think about the big picture. And the big picture is our health care and the people that have done harm to us. Is there something else you'd like to say, Ken?
Yes, Ms. B. Remember Rockefeller, the Rockefellers, back in 1984, and this is scary. He wanted workers, not thinkers. Now go back to the statement we were saying about doctors getting replaced by people who's not skilled. They're not actually thinking beings. They're just going in there because, well, Big Pharmaco says this. So instead of having their own opinion, they're going by the pharmaceutical companies or the FDA, the Food and Drug Administration, and all these medications are getting passed. But the question of the day, have these medicines been truly tested? How many people they've been tested on? How many people have been lost? Are we a clinical study? What is human life?
Once again, the majority of the drugs that we initially take is out of China. And the doctors want those drugs to be made in the United States because that is another problem that we have, because we get a lot of callbacks on medication. But you can't call back a life once that medicine has been taken. You can't call back a life.
One of the medications that got called back a lot back in 2022, metformin.
Metformin has been, it's many medications out there that has been called back, you know. And it's medications that we've taken over the years that has caused other problems in our body. It shouldn't be that you take a medication and a doctor expect for you to live with the side effects. It should be, once again, you go in and you don't sign off for lifelong treatment on a medication. You should sign off on lifelong nutrition. And that's one of the things at the top of my list for doctors to have, is the nutritional aspect, instead of just having one side that is just all pills, aggressive surgery, aggressive all the scans. That it shouldn't work like that.
And 12 hours of nutrition, when if you're going in as a doctor in the medical field, they should up it at least to 300 hours of nutrition, because 12 hours is not enough. because 12 hours, all you can say, okay, that might work. But here's a pill. The problem with pills is more problematic and symptomatic because you have, okay, let's say you're taking something for your eyes. Then 5 years later, there's your kidneys. Then then your liver. It's all a system, not a puzzle. It's a whole picture.
Also, I want everybody out there who has a senior parent, the AARP community, whatever community you want to call it, please check on your people, because if they're in a facility, go check and see about their medication, because a big problem is a lot of that medication is not being monitored, and they have been on the same thing for years, and nobody has went in and looked at their medicine, and that's so dangerous. The biggest risk factor for seniors, elders, is that when they're taking just sleeping pills, and that is very dangerous. When they could just drink some tea or something that could arrest the body.
Caramel tea, peppermint tea.
This has weighed on my heart a lot, but I wanted to come, and I wanted to come correct. And I have said many times, I will not get on this camera. I will not get on this camera without any factual information and documentation. I can only tell you what I have lived, what I have survived, what I don't want to see you go through. Why should you? Why should you? And I hope more people, and I call myself a new G, not an OG, because I'm willing to learn. I'm willing to change. I'm willing to listen and hear your heart. I want to see your success. I'm not sitting here for the beef. I'm not sitting here being jealous. Not trying to reach another milestone. No. And if you knew as much as I knew about the body and the scars that I have on my body versus the scars that I don't want you to have, you would never, ever, and listen to me carefully, you would never do a BBL. You would never put anything in your breast. Once you go up under that microscope and you've done all this to your body, expect the worst.
And the worst is each time you get a surgical cut, it will impact your immune system. It will break it down. Like, they say a common cold. That common cold will take you out because your immune system it keeps breaking down to the lowest common denominator, and you're out the box.
Now, I'm going to say this before I get off. I want every content creator, whoever comes up, and I hope we don't lose any more, because we lost DMX.
Shock G from Digital Underground.
We lost so many people. But you missed the point. You went in personal. And you never, ever mentioned the healthcare system. You never did.
And the question is why?
But it's many books out there, not just Dr. Brawley's book. And it's many people like me out here that have lived it, survived it, and we're putting up our dukes up against it. So like I said, Miss Linda is not going to tell you or make up something. I'm going to give you the facts. Or I just won't say anything. If I haven't lived it, if I don't have the facts on it, I will say nothing. I don't hold conversations with people that I don't know anything about.
If you're not about the business.
And go ahead.
If you're not about the business, if you're not about the education, and this is a disclaimer, please do not show up. We're not here for stupid stuff. We're here to be serious. This is about not only her life, my life, your life, your family's life. Please come up, educated, be ready, because there's going to be questions, tough questions. This is nothing personal. This is something to help you. We want you to succeed. We want you to make that money. But what is money? Learned this from Sheldon Anderson, rest in peace. He had all that money, but what happened? He was in the wheelchair, getting pushed around by his kids.
And like I said, before any content creator goes out there and address this young lady's life and her partner's life, do it with dignity and respect.
Come correct.
Please. So, if you up for the challenge, I'm up for it. I'm up for the challenge. And when whoever want to come out, read it.
You better read first.
Let's talk about it. I don't have to read it because I'm in the book and I lived it and I escaped it. Not quite. And my family paid the price for it. Your family has paid the price. And I don't want you guys to be the next chapter or the next book.
Or the next generation.
So we're going to have to fix our healthcare system. We really do. And that's why that young lady is no longer with us. Doctors that are not doctors. Nurses that are not nurses. The insurance company.
Not really an insurance company sometimes.
Think about it. Do not pull up. Do not make another video until you read this. And let's talk about it. Rest in peace, Jackie O. And for the many people that suffered under the hands of the healthcare system, may you all rest in peace. Thank you.
And God bless.